session with Dr. Anand. Right? Okay. We are on live now. We're going live. 30 seconds. Okay, it's 2 o'clock. I think we can start the show. Right. All right. So, start the show. Good afternoon, everyone. Welcome to another episode of Meet Our Expert. I'm your host today, Kok Hao, Batch 22 from PIDC, and my friends who are going to host with me today, Amalia.
Good afternoon, everyone. I am Amalia, a fourth-year dental student. So before we dive into the topic, allow me to introduce our expert for today, who received his Master of Dental Surgery degree in Oral Medicine and Radiology. And he is one of the esteemed lecturers in Penang International Dental College. So let us welcome Dr. Anand Krishnan.
Hi everyone. Thank you for that warm welcome.
Okay, sir.
So,
For today, our topic is about oral wellness. And as you can see, it's a really wide topic. The scope of the topic is so huge. Can you give us a head up about like what we are going to discuss today?
when we mean oral wellness, it means that we are living well, devoid of any diseases or disorders per se. When it comes to the oral cavity, there are a lot of diseases and disorders that involve your gums, your teeth, your the tissues, your cheek and your lips and everything. So being devoid of all this generally refers to the term oral wellness. And today in our program, we are going to just focus on what are the factors that can actually lead to these kind of disorders, how to prevent them, and how to treat them as they are. So we can just move on into the topic.
Okay, so let's start with the first part of today's topic, which is mouth ulcers. I'm pretty sure many of us have had mouth ulcers before. Like I myself, I recently got mine 2 weeks ago. So can you explain what are mouth ulcers and is it similar to cold sores?
Okay, mouth ulcers is a very broad term. Cold sores is generally confused with mouth ulcers, but cold sores are generally direct impact of an infection that is there in the oral cavity, because of which first it forms like a bubble, what in medical terms we call vesicle, inside or around your mouth surfaces, which then breaks off and then becomes an ulcer. Whereas an ulcer can be a direct wound in your inside your oral cavity or anywhere around the lips. It can be due to various reasons. So they are actually different, but they all come under the umbrella term mouth sores.
Sir, for the various reason of ulcer getting formed, sir mentioned just now, like is it always related to a trauma, or is there any some other issue? Because in our culture, we believe that body heatiness is the main reason we get an ulcer. So is that true?
Yes, it is a very popular belief that body heat generally leads to mouth ulcers. It might not be entirely wrong. Only thing is, the concept is a little confused. They can be they go hand in hand together. They are not a direct impact of each other. So, like for example, in case of an infection, the person might have fever as well as ulcer, but it is not necessary that ulcer is a direct as a direct impact because of the fever or the increased temperature per se. There are various causes that can cause ulcers. Trauma, I mentioned trauma because trauma becomes the majority. If you take the reasons of mouth ulcers, trauma tends to be the major factor. In most of the cases, in today's date, everybody loves mouth watering, food delicacy. You tend to get a little excited, and then you tend to bite on something a little harder, and you can't just wait to take a big chunk of pizza in your mouth and give it a bite. So in those terms are generally what you accidentally tend to bite on your cheek. And there are other conditions where when your teeth are not when there is malocclusion, which we generally which can be said as when there is improper arrangement of the teeth, or sometimes when there is like a pre-existing restoration or a crown which is not done properly. Those kind of things usually, when you accidentally bite, because of these things they can cause mouth ulcers, they being the majority of the reason. Other reasons for ulcers can also be infection. Another most common reason is stress and anxiety, and also malnutrition. So these are the other factors that can, that tend to commonly cause ulcers. There is another factor which is the least factor here, which are systemic disorders, like any you have any problems or any other disease in your body, they can also have an impact in your mouth. So that is the reason why there is a common saying that the mouth is window to your body. But I would go as far as saying mouth is not just the window of your body; it is both the window of your body and your soul. That is your mental health. So even mental distress and depression, anxiety, and other mental disorders can also have a direct impact on your mouth, thus causing oral ulcers.
Yeah, that's why I hear that a lot of students they will get ulcer when it's the time for the exam or when it's
Yeah, yeah. We come across them very commonly. See, you should in this aspect you should always you can always question a dentist or an ophthalmologist. Just before the exams, you can see a swarm of students walking in with oral ulcers, or getting constant headaches, or irritating eye or something into the ophthalmologist office. These are common symptoms of exam stress rather than that of anything else.
Yes, so sir, how long does it take for an ulcer to heal?
Usually, the ulcers which are caused as a direct result of, let us say, trauma, or which is caused due to minor stress or something, or these are usually self-limiting. Most of the ulcers are actually self-limiting. The healing time may vary somewhere from 1 week to 3 weeks, depending upon depending upon what is causing it. But there are certain group of ulcers which can prolong more than 3 weeks. These fall into the more kind of like dangerous category, which you have to be very cautious of. If an ulcer is if you have a long standing ulcer which is existing in your mouth for more than, let us say, 2 to 3 weeks, then immediately you might have to seek attention of medical care or medical help.
so sir. For my own experience, when I have an ulcer, usually I just let it there and I just endure the pain and the trouble it brings to me, and it will heal by itself. But is there anything we can do to like make this process less painful? Is there any treatment?
Yes, see, one factor that I understand as a practitioner, we all understand as practitioners, is that we are not available all the time around the clock. A dental office usually has a timing, so they get an ulcer sometime around late in the night, and they cannot keep wandering around searching for a dental office for treatment. So there are the government permits certain medication to be dispensed everywhere. So if you walk into a 7-Eleven or if you walk into any superstore or any store for that matter, you'll find a section where they have put some medications there. They are called over-the-counter medications, which are generally considered safe for most of the population. So the medicines dispensed in those counters usually for when it comes to mouth ulcers or something like Bonjela, which has basically the chemical property of it is siliconium. It might have a small trace of lignocaine, which are all just numbing agents. So when you are having pain because of mouth sores, what you can do is for a temporary relief, you can just walk into a store, get one of those gels, and you can apply it directly over the mouth sore. But you have to be very careful. There are certain in certain stores we have noticed that they even dispense low-level steroids like triamcinolone, and they also dispense certain other medications which are not suitable to be put or dispensed as over the counter. So again, you can refer to the box directly to see if it is safe enough. Okay, and and do not self-medicate yourself too much also. If the problem persists, please always seek medical help, because when you apply the wrong type of medicine, for example, in certain cases, if you apply a low level steroid in some people, that tends to trigger an allergy, and that might cause even more ulcerations. So it is always not a good idea to self medicate us. There is a limit as to which we can self medicate. If there is pain and if there is pain and increased temperature, then you can take paracetamol, which is considered very safe as a safe drug. And for topical application, you can use something like siliconium or lidocaine.
That is interesting. So, is there anything that we can do to prevent mouth ulcers?
Mouth ulcers, in many cases, other than let us say trauma, or any direct impact due to chemical burn or something, it is basically caused as a manifestation of something else. Okay, there is the disease and there is a symptom. Many of them treat, for example, if I have to relate it to something, one example that I can give you very easily is fever. So if you take fever into consideration, many of them think fever is a disease, but in most cases, fever is just a symptom. It is just body's a way of mechanism of fighting any microorganism. Similarly, in many other conditions, ulcer is just a symptom, not necessarily the disease itself, although it has to be treated straightforwardly. Now we have to find the cause, what is actually causing the ulcer. So like I said, there are it's a multifactorial thing. So there are many factors that can cause ulcer. So one being trauma. Trauma can be easily alleviated. We have to be a little more careful. But if it is trauma caused due to faulty appliances or restorations, you might have to change them. And people who are wearing braces, they might also constantly get ulcers here and there once in a while. So you can probably consult your orthodontist, find out his opinion about making some adjustments in terms of reducing the frequency of ulcer formation in your oral cavity. So these kind of trauma things can be alleviated by removing the factor that is actually causing it directly. But then there is a factor like emotional and mental stress. These we generally when a patient has these when goes through in today's lifestyle, especially after COVID, a lot of people are under a lot of financial, mental stress. Students are under mental stress because they have missed classes and they're going back to school and they have a lot to catch up. People who are working have a lot of stress. They have to make up for the loss that they incurred during. So all these puts a stress in today's date and lifestyle. We cannot ask people take little stress, but we can try our best to de-stress ourselves. We can follow some healthy practices, engage ourselves in something like meditation, yoga. Every culture offers some form of
Relaxing,
activity
like
to activity to relax ourselves, disengage ourselves from the stressful environment that we are in. And furthermore, if you are a person who is chronically under mental stress or something, then you might also seek for mental counseling and help. There is always people help. Even the government has given a lot of numbers, and a lot of organizations are there to help cope up with mental stress and mental disorders. So this it can help in this way. And the next thing that you can do when it comes to infection is that infection, you have to be very careful. Infection, mostly when an ulcer is caused due to infection, it doesn't come alone most of the time. It usually comes in a combination of certain symptoms. For example, you'll have fever, you'll feel very tired, you'll have a general feeling of unwellness. So they are called prodromal signs. So you'll always have associated some kind of unwellness, and when it is because of infection, another thing that you have to notice is that I'll take a viral infection as an example. They do not just impact your mouth alone, in the oral cavity alone. You can see that the sores can occur even in your hands, in your body, in your genital area. And there is, if I have to point out one easy example for adults, is the herpes simplex infection. They generally refer it to as herpes. So when they get herpes, they get sores can be anywhere in the body. So that is one indication. And another example, especially in children, is what we call the hand, foot, mouth disease. Usually, children will have sores both all in their mouth, in their hands, that is in their palms, and also in their soles and the feet. So this is a common infection. So it needs immediate attention because they might need some antibiotic therapy. And also another important factor is that they need to practice certain hygiene practices. Keep away from other individuals because they are communicable. These certain infection related sores are communicable, especially herpes or the one in hand, foot, mouth disease. They can transmit. That is why if you notice in this thing in let us say in kindergartens, or let us say in daycares, or in children especially, if one is found to be, they tend to send them home or keep them isolated or something like that. Similarly for herpes also, avoid contact as much as possible because it's transmissible, can be transmitted. And in today's date, I do not want to we cannot emphasize much on transmission, as we all know we are suffering through one transmission already. So it is again the same practices for any virus. It's the same practices. Wash your hands, keep a safe distance, take a lot of fluids. Usually even the infection causing ulcers are usually self-limiting. They tend to go away. Our body has an innate mechanism of fighting back, and they tend to suppress these infections, and you tend to
Oh,
recover from it eventually. When a person is, let us say, medically compromised, or when he has a problem, then we have to kind of like add some antibiotics to their treatment protocol. So in those conditions, it is better when you find so many ulcers, that is multiple ulcers. I would go as far as saying, if it is a single ulcer, you can wait. You can use topical medications, try to control the pain, wait it out for some time. But if you find multiple ulcers in your mouth, or along with elsewhere in the body, or associated fever, then I would recommend that you seek medical care immediately. It is most required.
so it's interesting. Like the ulcer can be an indicator for so many different of disease or illness in the body. Now, sir, can we have a look at the audience question? We have one questions coming up from Lukman. He asked that,
Okay.
"But sir, I heard that salt water can be used as a treatment. Is it true?"
Salt water, yes. Salt tends to have kind of like an antimicrobial activity. That is the point where this thought is derived, that salt. But for example, if you're having a throat infection, upper respiratory tract infection, a lot of recommendations would come as gargle your mouth with warm water or salt water. This tends to alleviate it. As much as salt can help, but it can also sometimes be irritating, especially newly erupted ulcers. It can cause certain amount of irritation and pain also. I would recommend that you can use salt water for your regular maintenance of your oral wellness, but I would recommend that you kind of like restrict yourself to conventional mouthwashes, not even the medicated one, conventional mouthwashes which are available over the counter, just to maintain oral hygiene. The mouthwash does not itself heal the ulcer. Let's just debunk it. The mouthwash, salt water, cannot heal an ulcer. What salt water provides is it provides a little bit of an antiseptic environment within the mouth. It does not necessarily heal the ulcer directly. But what we have to be careful about when you use something like salt water, you should ensure that it doesn't end up irritating your ulcer even more than it is already.
Thank you, sir.
Thank you,
So we
sir.
have another question from Muhammad Farhan. Good afternoon, sir. You mentioned, can infected tooth be extracted?
Okay, that is it's a very broad question. We have to determine how much of infection there is in the tooth. Depending on that, as a dentist, for any dentist, the primary goal is going to be saving the tooth as much as possible. We are not going to look for reasons which will end up in extracting the tooth. Extracting the tooth is always the last resort of treatment that we follow, and if the infection has spread beyond a point that it is making the tooth to be loose, it has loosened the tooth in the oral cavity, or let us say, for example, there is too much destruction of the tooth structure, then no other choice but we will have to extract it. If the infection is too much, sometimes they might prescribe you antibiotics along with it, along with the procedure. But it all depends on how much infection or how much destruction of the tooth structure or a tooth supporting structure is there before we go for extraction. In most cases, we tend to save the tooth. That's this thing. We can always, there are modern treatments that are available to save a tooth as much as possible. We can always go for it before extracting. We see only if the options run out, then we extract the tooth.
Yeah, because the original one is always the better. Okay,
Yes.
sir. We should move on to discuss the topic today. Another questions I get asked a lot from my friends or even from my juniors is that halitosis, which means bad breath in the layman term. That like the smelly mouth. People ask like,
Yes.
what is the cause for halitosis or bad breath, and
Okay.
how do we know that we have a bad breath? Because sometimes you cannot self-discover the thing.
Yes, see, there are a lot of scientific ways to measure or identify halitosis, but the easiest way to identify halitosis, if you have a spouse or if you have a friend, they can probably be honest with you and tell you that man, your breath stinks or something like that.
Oh God.
Uh, Causes for halitosis, yes, halitosis is a very serious problem, especially for people who need to go out and mingle with other people, who needs to have a face-to-face interaction a lot with other people. For them, it poses a lot of challenge, halitosis. And in 80% of cases, halitosis is because of something to do with the oral hygiene. Only remaining 20% has something to do with your wellness of your your throat, respiratory tract, your digestive tract, and everything, your general fitness. But 80% is because your oral hygiene or something in your mouth is actually causing it that order. So among them, the most important part is your oral hygiene is the tongue, cleanliness of tongue. We all very well wake up, brush our teeth nicely. At least we even brush our teeth twice a day, but not a lot of focus goes into cleaning our tongue. If you note, there is something called as taste buds on our tongue. They are called the papillae, and a lot of food trapment happens within these papillae. And especially if you are having, if you're someone who consumes a lot of food which has, which has the tendency to, give a strong, odor or smell, they tend to, yeah, like garlic or onions. These tends to get stuck there, and when you do not clean your tongue properly, they tend to stay there. Some people can see that there is a thick white coat over their tongue surface. All they have to do is just stand in front of a mirror and stick their tongue out. They can see a thick white coat of over their tongue. In some people, it might even be a brown or a blackish coat. So these people need to focus on cleaning their tongue. For majority of people, this itself alleviates. You can add something like mouthwashes, and you can implement more things into your oral hygiene practice, like flossing, like usage of mouthwashes, interdental brushes, to get rid of all the food debris and everything. And these mouthwashes can also have little scent. But we do one wrong thing that people generally do to alleviate odor is that uh, uh, they'll already have consumed something that is odor, and to nullify it, they'll consume something more. Some people have the tendency to chew on mint leaves and all these things. Now, this is not going to remove what is causing the odor. This is just going to like suppress the action for some time. It's going to like freshen your bed for some time. After the action of those mint leaves goes off, the old fetid odor is going to come out again. So ultimately, you'll have to remove the cause, what is actually causing this odor. So you'll have to clean your tongue and keep your oral hygiene well. Then this is the major factor. And also you'll have to also, I would personally recommend that once in a year you just go for a general checkup to your dentist, find out if there are any tooth that are in that has dental caries, or that is that is prone for, that has more possibility, or it is prone for infection or anything like that, because these kind of dental problems might also give rise to odor, fetid odor. We might not even know it is lying somewhere in the back teeth, which we generally do not have visionary access to, might have dental caries which might be causing this odor. We might not be aware of it as such. So it is important that we check thoroughly that none of this. And people who use dentures and people who use some appliances, they need to clean their appliances regularly. Generally, the whenever they are issued some appliance, let it be for the orthodontic purpose, that is tooth arrangement purpose, or let it be for dentures, false teeth. So they will, when they issue itself, they'll give them a general instruction that they'll have to clean it quite regularly, and they'll teach them how to clean it also. But accidentally or for some reason, people tend to wear it and sleep off, and they don't clean it as regularly as they should. So these kind of things causes accumulation of microorganisms and food debris, which results in odor.
So regarding cleaning of the tongue, is there any specific instrument that people can use?
Yes, in nowadays they supply a very in the toothbrush, on the back of the toothbrush they supply a rough surface that is specifically for cleaning the tongue. But I would personally recommend that you get something called as a tongue blade. It is available commercially. A lot of shops sell them. Be a little when you buy them, examine that they are not too sharp. They are available in plastic and metal. Whichever they are, ensure that they are not too sharp, because they might end up injuring your tongue surface. So ensure that they are not too sharp. They are little blunt. Okay. So you just ask, uh, you just ensure you just clean your tongue regularly using a tongue blade, which is very effective in terms of removing the debris that gets accumulated in the tongue. You practice this a week or two, and you can literally feel a change. If it is a local reason that is causing the fetid odor, you can literally feel a change once you once you clean your tongue, use some mouthwash, and try to keep. And another practice that we can actually follow is like gargling your mouth after every meal. That is a good this thing. Ultimately, what gargling translates to is that we use water or some form of medium to mechanically slush out all the food debris and whatever is accumulated inside the mouth, and we spit it out. So by that, what happens is that it tends to kind of like we tend to remain whatever is retained, whatever debris is retained, and we remove them. So by then we remove the odor too. When it comes to other causes that can cause fetid odor, another one is upper respiratory tract infection. You might as well felt it yourself when you have had severe fever and throat infection. You might have felt some bitterness in your mouth, along with some unpleasant taste and smell in your mouth. So these throat infections can also cause this thing. And also another important factor is your your digestive problems. If you have any something like gastro intestinal esophageal reflux disease, which is called as GERD, or or you are a person who is more prone for your stomach getting upset or bloatedness, these type of things can when you burp or something, this kind of thing tends to give out a little bit of an odor. So these things are to look out for. You can address them by alleviating the factors that are causing, by addressing your infection, go to your doctor, get the throat infection cured, take some medication, or regularize your diet to keep your your bowel and your gastric wellness proper, so that you can alleviate mouth odors.
At least don't go to your girlfriend or boyfriend after you have eaten something like with garlic. At least try to rinse your mouth before. Okay, sir, we
Yeah.
have a question from Zising, and she's asking, is there any home remedy I can use to treat ulcer before I go to the dentist? I think we have discussed about that, but sir, do you mind to like
Yes,
repeat?
yes, sure. So you can like seek over the counter topical medications to which you can directly apply over these ulcers to alleviate, to that is to control pain. But the ulcer itself will take time. There is no magic remedy that can make the ulcer vanish away like that. It doesn't happen like that. So it takes its time to heal. So it might take anywhere between 1 week to 10 days. If it's a normal ulcer, it might take anywhere between 1 week to 10 days to 15 days even to heal properly. So in the meantime, the major factor that we are looking for is keep away the discomfort, keep away the pain, and keep away the burning sensation that these ulcers causes while we speak, or while we eat any food, or while we are interacting or doing something what we generally do. So for this, the main factor that you need is pain relief. And for that pain relief, you can use these topical medications to alleviate the pain. And if the pain still persists, that pain is probably because of not just the ulcer itself, it's also associated with the inflammation around the ulcer. So if it persists for more than, let us say, 2-3 days, then I recommend that you see your dentist and get it sorted out. When it comes to home remedy, I wouldn't recommend anything personally. I wouldn't recommend any self trial of anything that is unwarranted for. Yeah.
Thank you, sir. So we received another question from Noralia.
Yes.
Regarding denture cleaning, is there recommended product to be used, or using toothpaste only is enough?
And also, sir,
Okay.
I have
Yes.
something I want to add on. Like a lot of the patients, they say they will brush their denture with their toothbrush. Is that okay? Will it damage the denture?
Okay. So denture cleaning, I'll start with how to clean your dentures. So denture cleaning, you will have to definitely remove it. And now there are commercially available suspensions that are available, that is liquids that are available, where you can, they come with a box also. So if you check out your pharmacy stores or even online stores, you can find denture boxes which you can pour liquid in, and you can immerse your this thing, and you can leave it there. Basically what they contain, these liquids contain, is a little bit of antiseptic property. So but you have to ensure that they are not these liquids are not stained, that is colored liquids, so as it might impact the color of the the denture itself. So just normal water will do. There is no any compulsion that you should buy any product to immerse your dentures in when you're storing it overnight. Just put it in plain water. Then next day, before you wear it, use a very soft bristle toothbrush, and just brush over the surfaces. So basically our dentures are basically made of a type of plastic which is called acrylic. So you don't need much of any chemical agents to really like scrub or do anything like that. All you have to do is gentle cleaning of the dentures using a soft toothbrush. And I do not know how much of benefit toothpaste brings for fake teeth. I do not advocate for that, but you do not need it also. All you need to is just clean it with running water nicely, and then use soft brush to remove any surface debris that you can see over the denture, and again clean it with running water, and you can wear them. It's good to go.
Right, sir. We have received another questions, but because the user is not really familiar with Facebook, then he asked me to
Okay,
read the questions lah. So he
sure.
said that he has a really bad gag reflex, means like he tends
Okay,
to like wanted to vomit when something touches
okay.
the behind portion of the mouth. So he asked, can I still use the tongue scraper even though he has a really bad gag reflex? Or is there any other method to replace a tongue scraper?
Okay, so the most effective method for removing the debris over the tongue surface is your tongue scraper. It's a mechanical way of removing the
It seems like we have a little bit of technical issue.
advocate to go him as deep as possible. Not Let him not go too deep. Let him at least clean the anterior two-third of the tongue using a tongue scraper. But for the remaining part, he can just use a commercially available mouthwash to gargle his teeth. What he can do is, instead of just taking it and swishing and the way how we have to do mouthwash is that. Most of the commercially available mouthwash, please do not use them directly. This is something I want to emphasize on. Most of them tend to be a little concentrated. Usually it is very clearly labeled and mentioned on the bottle itself. You can that you're not supposed to use this directly on your in your oral cavity. You have to dilute it well with a considerable amount of water. So what I would recommend is dilute these mouthwashes in a glass of water, which is about 200 ml or something like that. Okay, and then you can take a small bout of mouthwash in your mouth, give it some time, give it at least 15 to 20 seconds, nicely swish in your mouth, and then spit it. Then continue to do until you finish the entire tumbler. This is how mouthwash. Or if you are going to take a large bout, that is, if you're going to take half the glass of the mouthwash in your mouth, then I would recommend that you leave it for some more time, like 20 seconds, nicely swish, and then spit it out. So when you do that, you give enough time for these agents in the mouthwashes to properly act within this thing. You cannot just pour it into your mouth and spit it immediately. You have to apply some mechanical. That gargling is called the mechanical process. You have to nicely gargle for all the food debris to dislodge from all the surfaces, and then you spit it out. So this way you can get rid of most of the debris, but still mechanical way is the best way to get rid of all the debris that is stuck to the tongue. Mouthwash is the second best choice to get rid of all the debris.
Interesting. So now I think of it, like every day we look into a mirror to like to tidy up ourselves, but like we seldom take a look into our mouth. And now after listening to what Sir have told us, like I found that there can be a possibility of so many things going wrong in your mouth. Is there any way we can have a look, like to make sure nothing goes wrong?
Self-examination.
Yes, this is especially emphasized when we talk about when the topic of oral cancer comes into conversation. We generally advise everybody to self-examine their self when it comes to the oral cavity. Self-examine themselves once in a month. It is a very very simple process. It's an 8-step simple process where you are going to examine various surfaces of the oral cavity. So what you end up doing is that you are going to check the various surfaces of your oral cavity by you're going to stand in front of a mirror, and you're going to examine. First you're going to lift your lip, look into the look into the mirror. Then you're going to look at the your other surfaces, your tongue, the floor of the mouth, uh, all these surfaces. Okay, so this is called an 8-step oral examination. This is predominantly advocated for cancer. This is not generally recommended for other, but I would say that you can incorporate while examining for oral cancer, you might as well see for abnormalities. So what are the abnormalities that you need to look out for? They're like something like like any white or red patches, or any white or red lesions that you see on your cheek and your lip area, your tongue area. When you see them, there is a good chance that you might you might identify them early on, so that you can also prevent them from happening.
Right.
Yes.
So
Thank you for
regarding the ones that we see visually in the mouth, what are those white patches or any color changes in the mouth? What are they exactly?
In in medical terms, we generally refer to them as uh, red and white lesions. If I have to put it in simple terms, they are called red and white lesions. So what happens is that you will find a red patch on the surfaces of the mucosa, and when you self-examine yourself, you will tend to notice that your normal cheek mucosa, that is your cheek and your lips and everything, are supposed to look somewhere between pinkish red in color. Not necessarily very pink, it can be dark pink or mildly pink, but it is if you find something, if you find something like if you find some patches like this, as you can see in your screen now, if you find some patches, white patches like this, or if you find some white changes like this, or some redness in your mucosa, then these are things that needs to ring an alarm in your mind, and I would recommend that you immediately visit your dentist nearby to find out. Most of this are direct impact of have a correlation to people who tend to use tobacco products, end up like smoking or tobacco chewing or anything like that. If you have a habit like that, I would recommend that you immediately stop smoking or stop chewing tobacco, betel nut, and all these products, which can cause these patches in your oral cavity. And if you find these patches, immediately I would recommend that you visit your nearby dentist and seek medical counseling.
So we received another question from the audience, Shalini.
Yes.
She asked, is the term screening same as dental examination?
Okay, examination is something that is done thoroughly with aids and with an expert, whereas screening is something that you can you tend to do by yourself. So, for example, how can I put it? There is a screening process which we today most of the places do. For example, when you walk into a supermarket today, they check your temperature. They are not diagnosing whether you have COVID or not. They are just screening to see that if you have a possibility for this is screening. So there are things that can get through the screen and come, but examination is something that is done a little more thoroughly. So you use aids in examination, and you use an expertise. You need a certain level of expertise to perform an examination, whereas screening is something that is done a little more on a bigger level.
So if let's say today I examine myself with
Yes.
maybe have a look, and I found that there's something, maybe a white patches in my mouth. Other than immediately visit a dental setup, is there anything else I can do? Like maybe
Okay, you
where we I cannot access to the dental clinic right away. Is there anything I can do to at least like stop the progression of the patches?
you have to look like I mentioned before. Most of these patches and everything have a direct link to use of tobacco and tobacco related products. The research on vaping is still not very clear. There is mixed research. There are some research that says it does not have major impact on our oral health, whereas there are also researchers that actually contribute saying that vaping is as harmful as smoking a cigarette or something like that. So smoking, vaping, or tobacco chewing, all these have a direct impact on our oral mucosa. And when a person is a chronic smoker and tobacco chewer, what tends to happen is these products have certain chemical elements in them which tends to irritate the buccal mucosa, thus initiating it to react. And this reaction generally manifests as the white and red lesions that you can find, which then further over a period of time, when it is being constantly done, which further progresses to become oral cancer also. So they are technically called pre-malignant diseases. That is, they are not necessarily cancer, but they are something which can actually lead to cancer. That is why you see in all of these tobacco products, in cigarette packs, you can see a big cancer picture printed on top of it. That is the main reason for it. So most of the times these kind of lesions are associated with habits like this. So the first thing that they should do is stop these habits. Stop these habits, focus on their oral hygiene, keeping their oral hygiene. And next most important thing is being nutritionally stable. They should keep up their general physical wellness also, because tobacco product is not something that just impacts the oral cavity. Actually, the more easier disease to acquire by smoking, more than oral cavity, it affects your lungs more. So it has a general impact on the body. So it is very important that first you alleviate the your habit. Second is you make yourself physically fit, and that is you become healthy, you become more healthy, so that these are, at some stage, these white patches are reversible. So once you stop these habits, once you get into a good health, they will themselves reverse again and they will vanish off. But when it crosses a certain stage, that is what becomes a little bit of headache. You will need a medical treatment to counter these issues.
All right. So everyone, please go back and stand in front of the mirror, have a little look in your mouth, and also, if possible, stop smoking. As a dentist, we want to encourage everyone to quit smoking because it brings a lot of harm. Okay. Also, now we are at. I think we have moved on to a certain portion in our show. I want to encourage all the audience to ask again, and also, if you want to ask in Mandarin or you want to ask in Bahasa, it's okay. We can help you to translate the questions and bring to our expert.
Yeah. So, sir, we have discussed a lot on what we can notice visually in our mouth. I wonder if there is anything that we can do in terms of nutrition to maintain our oral health or achieve oral wellness in general.
Yes, nutrition is another key factor when it comes to maintaining oral wellness, which is directly relevant to our topic. In most of these cases, when patients come with oral ulcers, red and white patches in their mouth, without the reason of using their without the reason of usage of any tobacco or trauma or anything like that, especially in oral ulcers, when it is not a direct result of trauma or any stress or any other factor, it generally one contributing factor is malnutrition. Today, we all eat, we all focus in today's date, the focus is more on the diet in terms of building the body. So we are focusing more on the macronutrients rather than that of the micronutrients. Yes, my macronutrients like your protein, fat, and your carbohydrates are very essential for you to build your body structure, however, six pack, eight pack, whichever you want. But what you need more essentially for normal functioning of the body, it is not, you cannot just be like a statue with an eight pack. That is not going to really look pleasing. You should be an active individual when you have that. So that activeness, or that your mental function, your physical function, or majorly also depends on your immunity. The one thing which we all went on searching again and again during this COVID time is something, immunity. So all these majorly focuses on these micronutrients that we need to take, and these are mostly derived from our everyday consumption, food consumption only. But that food consumption has to have this component of micronutrients. Uh, so we have a hierarchy of kind of like what food that we are supposed to take, and majorly we tend to take uh, mostly what is available in the market. But what we need to focus here is that we need to take a lot of fruits and vegetables, especially when it comes to oral health. You need to take a lot of fruits and vegetables, milk, and also eggs. The important constituents or components for your oral health is that first is calcium. So this calcium is majorly derived from milk, and you can also take a lot of dark green vegetables, green leafy vegetables. These all tend to have a lot of calcium in them. And second most important is phosphorus. Okay, these are derived from bananas, eggs, fruits. Eggs is another very important valuable food for your for maintaining a very good oral health is, for people who eat it, is fish. Fish is a very good source of micronutrients. Fish, eggs, fruits, especially the very bright colored fruits. Bright colored fruits like red cabbage, or let us say, and vitamin C. Vitamin C is from lemon. It's another very important for your gum health. For your teeth health, you need calcium and phosphorus. For your gum health, the most important component is your vitamin C, which you get from lemons and other citrus fruits. So combining a lot of natural elements in your food is very essential. But today, we focus so much on the macronutrients that we take too much of milk products and wheat and other grains, and we also end up taking a lot of meat. And we have pushed eggs, fish, and and the fruits and vegetables to the the least small portion, whereas it should be balanced. um, I would recommend that you balance your diet in such a way that you are able to acquire all these micronutrients. But if you are not a person, if you're a very busy person, you keep running around, or it's not in your control of what you eat. Especially, you can notice this in our own students. They are mostly busy. They are running around, doing a lot of work. They do not get a good choice of nutrition meal. They have to survive with whatever they get nearby, and whatever is available for them. And this applies even for people who are working jobs, very tiring jobs and all this. So in these conditions, it is not an advocacy to multivitamin tablets. But when you don't have a choice, you can take supplements. You can take micronutrition supplements. These are again commercially available, which is again approved by various government agencies, and it is sold in the open market. These capsules, multivitamin capsules that are commercially available, you can just buy them and take one of them every day. So all you have to do is you have to ensure that you have to look for multivitamin, because you just cannot be picky and you cannot just choose one particular component. It doesn't work that way. That only works with macronutrients. It doesn't work with micronutrients. In macro, especially for people who are going through diet, they'll say increase your protein, take protein powder, cut down on your fats, stop fried foods, something like that. You cannot be picky like that with micronutrients. All micronutrients are very essential. And do not put your GIT, that is your gastrointestinal system, for a shock. Especially, I would like to convey this to people who are on diets, who go regularly on diets, who restrict themselves from eating normal food or anything like that. So if you are going to start with, if you're going to follow a particular diet, always do it under the guidance of a proper nutritionist or a doctor. And if you're going to follow a generic diet plan, ease into the diet plan. Do not suddenly change. Do not cut down anything abruptly. If you are someone who is used to taking a typical kind of food regularly, do not cut it down abruptly, because that itself might give an impact on your general health. And when your general health gets compromised, it will definitely manifest in your oral cavity, and that will end up causing ulcers and other problem, mouth sores and other problem. So a balanced nutrition, which consists your proteins, carbohydrates, and lipids, along with it all the vitamins and minerals, essential vitamins and minerals along with it. Every day, it is better to acquire all these essential vitamins and minerals from the diet itself. But if you are not able to, consult your doctor. Try to take supplements to compensate for the loss that has been created. So this will cause a very good healthy environment for your oral cavity.
Yeah, so it's those days when my mom will prepare everything for me, and her food is always
Yes.
nice, and all the nutrients will be there. Now we have another questions coming up from one of the audience. That translates to English in Woon Xing Yi. He said, "Good afternoon, sir. Is it common to have some discomfort when wisdom teeth coming out at first time? And also, is it recommended to remove the wisdom tooth?"
Okay. The wisdom tooth is another important this thing, especially in young adults, because that is the time where wisdom tooth generally erupts. That is the time frame where the wisdom tooth generally erupts. Young adults, teenagers who are in their late teenagers and early 20s, people commonly face this problem. uh, there is bound to be certain amount of discomfort while a tooth normally erupts. Yes, there will be some discomfort, but it is a transient thing. it goes away after a certain time. That is provided your teeth is erupting normally. So what we can do is when you can walk into a dental clinic and you can get checked whether your teeth is erupting normally, because wisdom tooth has this tendency. This is something that we cannot predict that easily, but it tends to happen in many cases that the wisdom tooth does not normally erupt and get itself in the position into the oral cavity. It tends to erupt a little slantily, or it tends to erupt like totally horizontal from another direction. So when these kind of things happen, it is advisable to remove the teeth. Nonetheless, individual situations has to be taken into consideration. I cannot pass a generic statement saying that we have to remove all the wisdom teeth. If the wisdom teeth seems to be problematic and if it can be a source of any dental problems for that particular individual, then the dentist will obviously recommend them to remove the wisdom teeth. But if a wisdom teeth, even if a wisdom teeth which is normal and it is erupting properly, a person is bound to come across some discomfort that is always there. So you would have commonly noticed this generally, like when teeth is erupting, permanent teeth is erupting, or even deciduous teeth is erupting, the small children, they tend to go crazy. It's called teething. They tend to bite on everything that they see. Even the soft toys are available these days in market, where they give the children to teethers, they are called, to bite on them, because it causes certain types of irritation and discomfort. Whenever a tooth erupts, it causes that discomfort. That applies to the wisdom teeth too. The only thing that we need to look out for, if it is erupting properly into the into the position. If it doesn't get into that position, or if it remains inside the bone for a longer time, that is, let us say for example over 25 years, then they need to be examined, and they need to be assessed for extraction. So if you ask me, all wisdom teeth needs to be extracted? No. And are you prone to discomfort during wisdom tooth eruption? Yes, but it's a transient thing. But if the discomfort keeps prolonging, or if it is causing pain, then I would recommend that you see your dentist immediately, and they will probably assess your particular case, and they might be able to tell whether you'll have to go for extraction or you just have to wait it out for a little further.
Thank you so much, Doctor. We received another question from the audience, Archana. She asked, does pickled fruits affect the oral cavity's environment if regularly consumed?
Okay, it depends upon like what type of pickle it is. Any food for that matter. You take the most healthiest food in this planet, and you tend to consume it regularly 3 times a day for all the days. It will still end up being bad for you. Even when the saying goes, an apple a day keeps the doctor away, they only said an apple a day. They didn't say take 10 apples a day, you can keep it away for a lifetime. It doesn't happen like that. So any food taken in moderation is okay, but you should not overdo anything. That is very important. Pickle, it is I don't know, in many other cultures, pickle is not essentially a main dish. It is just something on the sides. You just have it in a very minor quantity, so they just generally do not cause much of an impact. But if you are a person who is for a very spicy food and this thing, then you have to be a little cautious, because in some instances it is shown that spicy food tend to cause irritation and burning sensation in the patient's oral cavity. And they can have an they might not have a direct impact per se. They might not cause any at the worst a very bad quality pickle. What it can cause is something like a chemical burn inside your oral cavity. And it does not, but it has a direct impact on your digestive system, which can too much of pickle consumption can upset your stomach a lot. So take it in moderation. Anything you take in moderation is fine, especially in young adults. I don't know, there is a saying from where I come from. They say in an young adult, if he swallows a stone by mistake, even the stone should get digested. So they should be that fit and healthy. It's just a colloquial or local saying. They say it's just to show how fit a person should be, right? So that so anything taken in moderation is fine. Nothing will affect your health. Anything taken in moderation. Please don't go about taking ingesting stones. I'm not advocating that. I just told it as an example. But yeah, anything taken in moderation is fine. Too much of anything is not good. Again, even the micronutrients I spoke about, if you take too much of micronutrition, that is, let us say you try to you decide that you want to balance out all the deficiency you have, you cannot consume 10 multivitamin tablets at the same time, which might end up dangerous for you and end up in a hospital right away. So anything too much is dangerous. And if you take also your body, you have a wonderful organ in your body which is called the kidney. The job of the kidney is to retain whatever is necessary for your body, and it will chuck out everything that is unnecessary. So if you take anything too much, kidney will do its best to remove, and when it goes beyond its capacity, body finds a way to retain it, in various this thing. And anything taken too much is really bad. Take it in moderation, you'll be fine.
And sir, we have another question from our audience. Lee Wei Ping, he say, for a patient with burning mouth syndrome, yeah, we recommend a non-alcohol mouthwash for relief. He said,
No cooling effect. Okay, so yes, when we talk about mouthwashes, there are mouthwashes which are commercially available for everyday use. Okay, which you see like on the counters like Colgate Plaques or Listerine or anything like that. If you see in those sections also, and then there is another group of medication which are medicated medications which are generally prescribed by dentists. So in this commercially available this thing, there are two types of mouthwashes. If you have to put it into broad category, there are these mouthwashes which are alcohol based and non-alcohol based. So that is what he's inferring to. So some people don't tend to, some people who don't tend to want alcohol in their system at all, they tend to go for the non-alcohol based. Alcohol tends to kind of like irritate a little bit your oral cavity. That is why a lot of them prefer not to go for alcohol based mouthwashes. And it's up to their choice. It's up to their choice. And any mouthwash that you use, do not use it in concentrate. So like I told you previously, always dilute it. There are very few mouthwashes that are commercially available which you can directly take it from the bottle that is supplied in itself. Most of the mouthwashes that you use that are available in the market, you need to dilute it well. Once you dilute it, it just has a mild it has a mild flavoring agent to give you a good odor, and it has mild detergent to just clean your mouth. But when you take medicated or alcohol based, they tend to have additional components which is used for specific purposes. For example, if you are a person who has a dental infection, sometimes you can see your dentist prescribing you a chlorhexidine mouthwash. This is common when you have a gum problem, when you have gum inflammation, or when you have constant infections in your oral cavity. Some mouthwashes based on chlorhexidine, povidone iodine, that is your which is called betadine mouthwashes. So what they tend to do is they tend to keep your infection into control. They are medicated mouthwash. They are supposed to be used for a shorter term. You cannot use your chlorhexidine mouthwash forever, because at some point of time, chlorhexidine mouthwash, they lose their ability to function normally, and also they tend to give you some kind of side effects. You cannot keep using a medicated mouthwash for a long time. The best remedy is to go for over-the-counter medications, or you can use something as simple as your green tea. If you can afford it, then a mild very diluted green tea is good. Or you can also use like lemon water to rinse your mouth, or just plain water will do. So these kind of things can help you in terms of maintaining oral hygiene. In burning mouth syndrome, there are a lot of factors to be considered. If we come to his question, we need to find out what exactly is the reason why he's having the burning mouth, because just mouthwash alone, just focusing on the mouthwash alone is not going to help that particular patient. In burning mouth syndrome, I would recommend that the patient goes with non-alcohol based, medicated or unmedicated mouthwash depending on his condition.
Okay. Thank you, sir. Is it okay to answer one more question?
Yes, please.
By Leong Yi Xian. Hi, doctor. how would you recommend us in terms of managing our patient who have pain, but we are unable to find the cause from the oral cavity from X-rays and pap testing?
Um, okay, management again. Management has to be carried out in a dental clinic. Whether whether testing them with X-ray or not is another option. But management, I do not know what they are asking me in terms of management. If they are asking for medical management or if they are asking treatment, proper treatment. Most of the dental problems, that is dental related pain, the treatment resides in physically treating the patient, that is either by doing a restoration or a root canal or some form of a procedure. And very few dental related pain falls under the category which is medically managed. And medications are generally given after determining the how much of infection is there in a patient. If you do not have an access to a dental clinic, let us say for example you need to get to the dental clinic next day. Currently you don't have access to a dental clinic and you want to manage pain. You can take over the counter, you can take a paracetamol or something, Panadol or something like that to manage your pain, and then still visit a dental clinic. Treatment of any dental related problem is best done under a dental setup. When you do not have x-rays, it is not an issue. If it's a dental pain and you do not have x-rays, see, what you have to understand is in majority of private practices in Malaysia even today, they do not have a x-ray setup, and they still tend to treat the patient. There are various other we have various other modalities to check for the tooth's stability and to check the integrity of the tooth and decide upon the treatment. In some cases, yes, x-ray is absolutely necessary, then we can get the x-ray done, or in some cases we can do it without getting the x-ray done also.
All right, sir. We have discussed so far, and there's one more interesting part that we have yet to come to. That is the home remedies, because I have came across a lot of home remedies. Like for example, someone put turmeric powder on their ulcer and try to cure it, and someone take the baking soda and mix with the toothpaste to brush their tooth. Is it like how to say when it comes to home remedies? How do we know that it is effective? Should we try or should we not?
It's a very important topic to be discussed, because this is causing a lot of misconceptions and a lot of false information that is circulating around among the general public, because of all these because of the see, there is a good and bad for social media, and this can be considered the bad of social media. I've come across few of these videos in YouTube and some of some of these web pages which advocate for remedies, and I'm just surprised at the amount of things that they tend to give out as remedy. I'm just really surprised. I think the only thing they have not directly applied is a shoe polish on the teeth to make it whiter. There are like so many videos that they are like very misdirecting and misconceiving. The most popular one being there are videos and web pages which directly advocate a patient to use hydrogen peroxide in their oral cavity, which is very dangerous. If you do just a Google search or a YouTube search, a lot of videos are there advocating for use of hydrogen peroxide. And another popular choice is baking soda. uh, you know by the way these YouTubers are going, baking soda is like something that is derived from heaven or something. They use it literally on everything. I do not know what is their thing. It is just what they're trying to achieve is they're trying to just when it comes to teeth whitening, for example, they're just trying to bleach that is like they want to whiten the tooth a little bit. And anyone should understand that most of these chemicals that are used can end up being harmful. So when it comes to home remedies, there are do's and there are don'ts. So first I'll probably talk about the don'ts before I tell the do's. First of all, do not take unwarranted or unprofessional guidance. I put it as a request to everyone who is watching. Please do not take these YouTube videos as your guidance for your maintaining, for whitening your teeth, for treating your ulcers or any problem for that say. Turmeric, like you asked, turmeric has a very good it's a very good herb. It is medically, it is a miracle herb that they have found out scientifically that it has anti-cancerous property. But I wouldn't generally recommend taking turmeric powder and directly putting it on the on the ulcer. I wouldn't generally recommend it. There is a way. Probably you can follow these home remedies which are advised by experienced people like your grandparents or someone who knows much better about it. In traditional medicine, I would either you take it from a reliable source who won't just dispense you information as if they know something. Instead, who really have the experience. And most of these people are there at our home. If you're going to follow a home remedy, try take it from your parents or grandparents. Or there are today professionals who practice traditional medicines. There are practitioners who practice Chinese medicine, who practice Ayurveda, who practice Unani or something like that. So like this, there are a lot of traditional medicines that are available. If you're going to take it, follow their instructions. And number two is, for example, if there is oral ulcer, I wouldn't recommend, like you said, putting turmeric directly. Turmeric is a very good this thing. It's a very good. It is even the extract of turmeric is sold in capsules, but nowhere it is advocated that you directly apply turmeric. And turmeric also has the property to stain something. In olden days, turmeric was also used, to make dyes to stain because it has a strong. If you have doubts, you just put a little turmeric powder in your hands, nicely rub it, then wash your hands thoroughly. You can still see the yellowish stain of turmeric. And just a few days before, I came across a YouTube video where they were recommending usage of turmeric to whiten your teeth. Probably if a person's teeth is like too yellow, maybe turmeric makes it less yellow, but turmeric never makes your teeth white. So let's debunk that. And do not use chemical agents such as hydrogen peroxide, bleaching agents, or any of these chemicals directly on your mouth. If you want to whiten your teeth, if it is caused due to due to consumption of tea, coffee, or Coca-Cola, or any staining kind of food products, then I would recommend you to practice proper oral hygiene and get rid of those unwanted color changes. But if it intrinsically, if you have a tooth color with a mild yellow tint, what we must understand is, in the planet, it is very rare to see naturally clear white color teeth. It doesn't happen that way. It is more frequent in the African population, but in Asian and Caucasian communities, you don't see a very white teeth at all. It is always has a mild mild tinge of yellowishness or grayishness to their teeth. If you want that, for various reasons, for aesthetics or for various reasons, you want your teeth to appear white, I would recommend that you go to a dental office, see what kind of treatment is required for you. There are various treatments to make your teeth look whiter. We call treatments like bleaching, veneering, and crowning. So whatever is required will be chosen, and whatever suits you best will be chosen will be decided by the dentist and presented to you, which then you can choose to go ahead or not. But I would not recommend. There are a few products that are available in the market, some toothpaste and this thing for whitening your teeth. It's again a gray area. I wouldn't recommend you to constantly use this. Most of these products, they themselves say that do not use it for more than 30 days. So do not constantly use this teeth whitening toothpaste and products. And you can probably use them for a very short time as recommended by the labels. You go with some reliable, which are approved by the the food corporation and the dental associations or councils. Those products can be taken. And when it comes to keeping your oral health, one thing that you can do is, like I said previously, I've already mentioned it. You can use green tea, diluted green tea as mouthwashes. You can use lemon water. and you can do something called as oil pulling, which is very commonly prescribed, which has become a popular factor nowadays to maintain your oral wellness. But predominantly, if you're going to use home remedies, I would recommend that you follow someone who knows what they're actually telling you to do, who are wishing well for you. Do not follow these unwarranted or untested this YouTube and social media directions.
Okay, sir. I think with that we came to the end of the today's show. Is there any bring home message, like a short message for the audience to bring back today?
Um, Okay, so like I told you previously, mouth today, it's a common saying that mouth is the window to your body. But today I would confidently say, and I have enough research to back me up, that mouth is not just a window to your body, it's also a window to your soul and your mental health also. So no matter whatever goes wrong in terms of your general health or mental health, it is manifested in your mouth. And let's just uh, treat our body well and keep our oral wellness well. Your oral wellness also directly correlates to your general wellness also. By keeping your health in proper shape and proper way, you'll be able to keep an healthy oral environment too, and that directly correlates to your maintaining oral health, also has an impact on your general health. So we should treat our oral cavity with a little bit of care and respect, I would say, because you just do not be careful of what you're putting into your mouth when it comes to the food, the quality or quantity of food that you take, and the products especially that you use. This is something that I would emphasize on, be it oral hygiene products or be it makeup products or whatever it is. Be very careful what you use, and that will probably give you a very good oral wellness.
All
Thank
right,
you
sir.
so much.
To add, yes, please.
Please continue, sir.
It's okay.
So that concludes today's session on oral wellness. Thank you so much, sir. It has been really informative and interesting.
We really
And
learned a lot from today's sharing.
to
And also,
those,
I
Yes.
want to do a shout out to all the audience. If you have anything that you want to ask, if you want to uh, gain more knowledge, kindly follow our Facebook page as well as our Instagram page, and for more content to come. Right?
yeah, stay tuned for the next Meet Our Expert session. We hope you have learned and enjoyed today's topic. Yeah. So see you next
Thank you very
time.
much. See you all.
Thank you.
Bye. Take care.
Thank you very much, guys, and see you again on the next episode of Meet Our Expert. And also, thank you, Dr. Anand, for today's sharing. Thank you, sir.
Yeah, thank you. Thank you very much for inviting me on the platform. Thank you.
Thank you very much.